Hello and welcome to VentureBeat Transform 2020. I'm Seth Colaner. I'm the Editorial Director for VentureBeat. I'm here today with Rich Roth, who's the SVP and Chief Strategic Innovation Officer for CommonSpirit Health. And what we're talking about in this fireside chat is how COVID-19 is helping constituents reimagine healthcare using AI. So Rich, thank you for being here. If you would, just at the top here, just say a bit about what CommonSpirit Health is all about, and what you do, and what your role is there.
Yeah, Seth, thanks. What a great opportunity to be at VentureBeat Transform this year and to share a little bit about our story. So I work with CommonSpirit Health. CommonSpirit's the largest not-for-profit healthcare provider in the country. We service 21 states, and throughout those states, we're doctors, nurses, hospitals, clinics, health plans, and a number of other things, bound together by a common mission of creating a healthier communities and especially caring for the vulnerable within those communities.
Very good. So the pandemic has changed everything, and it's changed a lot in healthcare as well. And I think one of the things that we've all seen in healthcare is that it's accelerated a lot of the trends that have already been apparent in our healthcare ecosystem. Can you speak to some of the trends as you guys have seen them?
Yeah, certainly the pandemic placed a fast forward on so many trends that were emerging within the healthcare ecosystem. One of the really interesting things that I like to think about is if you'd say what is the most important device over the next 20 years for healthcare, a lot of people might point to the phone, others might point to supercomputing and other types of things that drive AI. I would actually argue it's a common household device, which is the blender, right? And I think what we're seeing by this fast forward button is an incredible blending of different parts of the healthcare ecosystem. So, if you think about how healthcare is designed, there's an acute world, there's an insurance world, there's a social services world, there's a pharma world, there's a lab world. All of these are distinct entities historically, and all of these are being forced together because one on its own cannot care for and succeed against this this pandemic that we're faced with. And so when I look at our patients, they don't necessarily think they're in one piece of a continuum or another. They have problems and they want those problems to be solved. So one example might be we had an individual that has an oncological disorder. And that oncological disorder, requires that they take a certain specialty medication. And in order to do that, they need to get it refilled on any given time, and we need to get that to them, in a timely manner. But with COVID, they're afraid, right? They're afraid to leave their house. They're afraid to go into a medical setting and a host of other things. And so we need to work really deeply to reach those patients and reach those patients in the right way. In this case, we needed to understand that, maybe it was a neighbor that could be the most influential person for this patient to really teach them in a way that we couldn't at a human level. And so, ultimately, there are behavioral health situations there are medical health situations there's access to care and transportation. All these things blending together are what's going to make a difference. AI's role is critical in that, because AI can cross so many different elements of care and offer up something that could be best received by patients, blending those different sections together so that the data helps inform the caregivers or the social workers or the friends and family in order to get better outcomes.
Yeah, well, and I think we should say too, to sort of paint the picture more broadly, CommonSpirit Health has a great variety of constituents, right? You've got folks all across economic spectrum and different sorts of areas. Can you speak to that just a little bit, just so we understand really, when you're talking about blending across sectors, you're talking about a pretty wide swath, right?
Yeah, so we service rural areas, incredibly remote areas where we're the only provider that exists. We service dense urban areas. And in each of these areas, we often are a different piece of a constituent. And so in some areas, we might be the hospital. In other areas, we might be the hospital and the health plan. In others, we may just be the physician component. And so, the reality is these ecosystems have historically been put together in ways that require intricate puzzle piecing. And I know everyone's doing jigsaw puzzles during the pandemic, but we really need to work on putting these pieces together. And you need to do it in a way that you respect the talent and the expertise of the other puzzle pieces along the table. So, in our case, we have great physicians and others that are incredibly well-trained experts in their field. If you look at a social services agency, I would argue they're PhDs in their own field. It may be, a food bank, it may be transportation, but, housing insecurity is a healthcare need. Food insecurity is a healthcare need. And so stitching those together would be, really a critical way in making our health system work effectively. And the same side on the deep science and the deep technology. I mean, those are experts in their own field. And part of it is, how do you bring these experts together in a way that they're collaborating on behalf of the patient and truly focused on integration and making that a seamless journey for those we serve as equal partners?
Sure. So we're talking about blending and we're talking about sectors. This is a multi-layered issue. And you said earlier, AI can play a big role in addressing this. Can you unpack that a little bit? Just explain what sort of AI tools you guys have and how you see it working.
Yeah, let me give a good example. As when people come into the hospital, obviously they want to be cared for in the most humane way possible and to have their issue addressed. And one of the things we often work at is something called length of stay. We want to make sure to take care of the patient and get them home and return them to wellness as soon as possible. And, in order to do that, when you're in the hospital, our nurses and physicians do something called rounds, right? So you can imagine there's a set of rooms in a hospital and you're walking from room 1 to room 2 to room 3 to room 4, and you're, addressing the issues with those patients with the goal to return them home. Historically, the operating workflow is to go, room 1, room 2, to room 3, to room 4. But take into account the power of AI and how can you make that change? So if we now know that, a certain patient of a certain demographic, let's say, a male of this potential age with a certain condition, maybe an orthopedic condition, if we don't, get them a PT referral or, on a Tuesday, by this time, they're more likely to stay an extra day or two from the simple operational mechanics of that happening. So, one of the great opportunities for us is to use AI and to say, you shouldn't go 1, 2, 3, 4. You should actually go to room 7 first, because if you don't get, based upon our thousands of analysis of patients, if you don't address the patient in room 7 first, they're going to have to stay longer than they would need to otherwise. And if they have to stay longer, that's, one less, bed for a patient in need. And, that's one less day that patient gets to spend away from their friends or their family or their lives. And so, using AI in that way, really to, accelerate our workflow and to clearly show to our caregivers, the clinical benefit of why that data is important is a great example of how technology can help enhance care.
Yeah, it sounds like kind of what you're talking about is a more personalized care, right? So it's not that every single patient is exactly the same and you just sort of evaluate, but it's really about meeting the very specific needs of the very specific patients in the ways they need them best. Is that accurate?
Yeah, I mean, sometimes I've called this the 31 flavor strategy. When healthcare was originally set up, and in a lot of places still, including many places in our organizations, it's more of a one-stop shop orientation. We have great caregivers that give her care, let's say in a primary care setting, a very common way. And maybe, it's slightly different if you use an Epic EMR or Cerner EMR and it's vanilla versus French vanilla or whatever you say. But a lot of people prefer and want other flavors, right, of care, Rocky Road or, Butter Brickle or what have you. And so what we're trying to do is both develop and partner with organizations that offer care a little differently. So as an example, a Medicare focused organization. So the most important thing for Medicare patients may actually be loneliness, right? It may be depression and loneliness, and we need to make sure that we address those types of things first and foremost in order to address the broader clinical things that they have. So in that way, the access point may look more like a community center where, people are playing bingo and people are online dating with other seniors or whatever the case may be. And while it's around that, you're also providing, medical care like diabetic foot exams, right, is one example. And so you've created a different environment for those individuals. Women what could be another, area where, a unique care model that, potentially blends GYN care and primary care and offers, a brand and an experience and a welcoming environment that's unique to women differentially than the population at large, et cetera. So one of the things we're really searching for is this level of personalization. I think AI can play a really critical role in helping to understand patients and the types of care that works, specifically for them, and then providing, options to that, unique set of care. So this additional flavors, we think, better engages people. In some way, it allows us to hire staff of the community to really blend in or support patients in a unique way that talks to them, that's different than a necessarily only medical view.
Sure. Well, and let's get into the hood of this a little bit then, if we can. Because I want to talk about this issue of data, because everything you're talking about, it comes from data, right? It comes from pulling in good data, assimilating it, sharing it so it's useful, and in all AI, data is everything, right? In healthcare, it's even more difficult, right? There's every time I listen to anything or attend an event or read anything about data in healthcare, and inevitably someone brings it back to this huge challenge of collecting and sharing data in healthcare. The data is siloed, it's incomplete, it's mislabeled. Even some of the imaging, the varying qualities, and so even applying AI to CT scans, it's much more complicated than it sounds. Can you just speak to that a bit? The challenges and solutions you guys have found in solving the data challenge?
I think all of the things that you said are incredibly accurate. I mean, there's different systems that hospitals have, that health insurance providers have, that other organizations across the continuum have. It's very hard to blend that data together. There's not necessarily a universal master record. I know Apple Health, as an example, is trying to do some of those types of things, but that you had to have turned that on, and you have to have an Apple, and you have to be able to read it in workflow, and a whole host of other things. And so this big data piece is really challenging. And I think there are a lot of organizations trying to pull that data together and find good use cases. But I think that's the key we need to focus on, is like, what is the use case, right? And maybe it's small data instead of big data. So I think big data and all these streams could work really well for life sciences research, second indication research, working on rare diseases, developing algorithms, et cetera. But there's also small data that could be really meaningful in an AI way. And so one example, we've been working on with some time is connected inhalers, right? So for people that have asthma, children, adults, others, being able to have sensor data that tells you where, when, and how often an inhaler is used it gives us fantastic information on an individual patient level. And so, as you can imagine, it's almost impossible to ask a kid, how many times did you use your inhaler today? Like 5, 12, 2, I don't know. And maybe it was 35, but you actually have the real data, right? And you have the real data to understand frequency, location, if there's a problem with a certain route that they're in or within their house, et cetera. And then we can bring those patients in and we can titrate their medicine in a way that allows them to avoid emergency room use or further health exacerbations. So that small level of data, that use case level of data, is so critical because, number one, it wins the hearts and minds of our caregivers. It shows them why using this data actually truly matters and what's important to them, which is healing patients and giving a patient a better quality of life. Number two, it shows the patient that data can be really valuable and that their caregivers are with them, beyond the 1 or 2 times they come into an office, throughout a year. And number three, it shows a way that data can be used within a form factor that people understand and it works. People understand how to use an inhaler. You don't have to have a separate password. You don't have to have a separate login. You don't have to do two-factor authentication and a whole host of other things that people are just like really busy in their lives. And they have great stresses and it's hard to do. It just works as you, understand a regular inhaler to work, but it unlocks all this power. And within that power, is the potential to heal. And so that to me is a really exciting way to bring data to life. And I always say, really focus on the use case, and maybe small data solves it rather than big data, but data is important nonetheless.
So when you say small data, you just described a situation where there's specific data about one patient.
Mm-hmm.
Is there value in community based data? So maybe all of the aggregate inhaler activity from a certain community in order to uncover maybe there's a hotspot of a certain type of ailment or whatever the case may be, as opposed to we don't need the entire world's data on inhaler use for kids of a certain age, right? We really want to know, I'm guessing here, we really want to know what's happening in a specific community. Is that fair?
Yeah, I mean, I think you need to know a specific community, and for that individual, it's a specific individual because they're right then and there asking for help. So absolutely, that larger data is valuable because then you can understand, is there, a housing issue, right, that needs to be addressed in terms of, broader impacts, or, on Tuesdays, is the wind blowing a certain way that's causing, a significant amount of trouble, and are those hours that you need to stay inside? So I think all that large data has tremendous potential. Prediction of, if you look at what's happening right now relative to, people are entering buildings and doing temperature checks and, other types of things. And so, I think we're starting to piece together these large data, specifically in this COVID period, where we can start to make assumptions on therapeutics or start to make assumptions on courses of therapies that tend to make that may tend to make better outcomes for those patients that are suffering. And so I think it is both. But I think often, when we're doing this data work, we don't want to forget the individual impact on humans at a micro level, because that's the story, again, that gets people excited. That's the story that a physician, a nurse, a social worker, that's used to going, left every day because of their workflow, decides to go right, left because of this new information. And so, the big data is exciting, but you have to utilize it in a way that shows the impact on the micro level.
Right. So we said that the pandemic has accelerated and exacerbated some of the problems, but ideally it's also accelerated some of the solutions. If you could look ahead a few years at what healthcare may look like, hopefully post-COVID, and ideally bolstered by a great deal of innovation, AI, and solve problems, what might that look like?
Yeah, I mean, I think, as we look to maybe a new normal, I think we have incredible potential to have a more equitable system, a system that focuses on prevention over illness. I mean, again, if you look at the outcomes for the most vulnerable in these communities, like people with diabetes as an example, that's kind of a failure of the prevention system. And if we can reorient ourselves and say, look, it's not a 40-year issue for dealing with this high blood pressure, or a 50-year issue dealing with this diabetic hemoglobin A1C. I mean, this could be a real issue with a new virus tomorrow, right? And so you need to get this under control right away. And how do we help you do that? And we need to, we need the integration and support and the care and the focus on primary care to do that. But I think if what comes out of this, horrible pandemic is a focus on vulnerable patients, a focus on the issues in community that result in these terrible health outcomes on a physiological level, such as heart disease and diabetes, cancer, et cetera, then we're going to be so much better as a country. But it really starts with making sure that the building blocks of health are there, and that the entire system is oriented and centered around prevention.
That's great. Rich, thank you so much for your insights today. Hope that you enjoy the rest of your transform. Appreciate it.
Yeah, really enjoyed the conversation. Thank you.